Thank you.
All right, thank you. Next is Michael Patterson. Name and city.
My name is Michael Patterson. I'm from unincorporated Brevard County, and I am the face of a Florida medical marijuana dispensary owner. I have a 20-year healthcare executive who's lived in Brevard County for over 16 years. My experience in healthcare has been far-ranging. I've been the chief operating officer of a $210 million skilled nursing company called Avante. We have one here in Melbourne. Avante operates in 4 different states. While I was responsible for our facility in Melbourne, we had a very good relationship with the city, the emergency medical services, the police department, and the zoning department. I've spent my entire adult life working and caring for people in need. Over the years, I've seen thousands of patients struggle with many chronic health issues. I've also seen those patients struggle with addiction and side effects of current prescription drugs. I'm very passionate about giving physicians the choice to recommend cannabis as a medicine to relieve suffering of our fellow man who need it. Furthermore, I feel it's my duty to use my extensive knowledge in multiple areas of healthcare to ensure that the citizens of Melbourne and Brevard County have access to a professional, safe, secure medical marijuana dispensary that benefits the patients as well as the overall community. I'm currently the Chief Executive Officer of Florida Apothecary and U.S. Cannabis Pharmaceutical Research and Development. Florida Apothecary is a dispensary that we hope to open in Melbourne in 2015, which will be run by healthcare professionals. U.S. Cannabis Pharmaceutical Research and Development is a planned cannabis horticultural and infusion facility that we plan on locating in Melbourne as well. I have researched medical marijuana zoning from all across the United States, from municipalities in multiple states. One constant that comes up everywhere is the 1,000 feet requirement to be away from any school, church, park, or daycare center. Some municipalities have moved the requirement to 2,500 feet. However, most cities have used the 1,000 foot threshold that the federal government has recommended, and they have found that sufficient. I applaud you for being proactive in debating zoning areas of the city to be used for medical marijuana dispensaries. I respectfully request you to consider the following. Consider zoning cultivation, processing, and dispensing of medical marijuana all in one location if possible. This enables cannabis operators to have a smaller footprint in the community, but provide more efficient service and security. This also decreases the number of locations cannabis will be present within the city. Consider using the light industrial zoning for all potential locations. From my time in Colorado, I was able to visit these locations in the industrial zoned areas. These locations were not seen by the general public and had to be sought out in order to be found. All municipalities in Colorado follow the M1 zoning for cannabis locations. However, in California, they do not do that. And that's where the stores became too prolific within the communities. The topic of medical marijuana has been very polarizing across the United States, and we are now starting to see that polarization in Florida. There are many rumors going around as how medical marijuana operators regulations will be drafted. Some people say that we will, quote, be a free-for-all with children and anybody else having access to marijuana, and society as we know it will come to an abrupt end. However, for anyone who's actually researched what other states that legalize medical marijuana have done and what the state of Florida is working on will know that this, quote, free-for-all is blatantly false. The Florida Department of Health is currently creating an extensive list of major requirements, security protocols for medical marijuana as we speak. These rules and regulations will be some of the toughest, if not the toughest, in the United States. My extensive background in the most regulated industry in America, which would be nursing homes, I can assure you that these facilities will be run by extremely competent people who are focused on the safety of the public, as well as following strict regulations. So furthermore, something that we have missed in this discussion is about jobs and tax revenue. My company plans on hiring 100 to 300 people within the first 3 years. We will hire nurses, pharmacy technicians, pharmacists, horticulture experts, IT professionals, and other personnel to ensure our patients are receiving the best possible treatment and care from community members they can depend on. Also, tax revenue can be used by the city of Melbourne to provide services for all the great residents. As some cities have chose to pass the buck on this issue, I commend the city to bringing the issues for discussion, and I leave you with a quote from our great President John F. Kennedy. Change is the law of life, and those who look only to past or present are certain to miss the future. Thank you.
Thank you,
Madam
Mr.
Mayor.
Patterson. Yeah, Ms. Tasker.
You know, one thing I've never quite understood is that there are many pharmaceuticals, drugs that we use for pain relief, relaxation, that sort of thing. And I agree marijuana is one of those natural drugs. Why haven't the pharmaceutical companies made compounds, shots like the previous?
It's a great question. They have in other countries. In England, there's a current study.
May I finish, please?
Yes, I'm sorry.
So why is that not happening here? Now, there might be many reasons, but I don't understand why we're treating this particular drug, cannabis, different than poppies, opium, whatever might be a pain relief. Why isn't it just manufactured in whatever form and sold in response to a prescription in a drugstore?
That's a gregreat question. One of the main reasons is cannabis is still illegal federally, so no U.S. corporation can either.
Is opium not?
Opium in its current form, but what the drug companies do is they make a synthetic form, and they've been able to use that in different drugs, the prescription drugs. There's a company out of England that is currently working in the 3rd stage clinical trials to do a spray that has cannabis in it, and it's supposed to help with pain relief. So they're currently doing it. My associate mentioned a study in Switzerland that they're working on that too. No U.S. company has been able to do that. We actually, with U.S. Cannabis, have applied to the DEA to attempt to grow cannabis to be used as research throughout the United States, but our application was denied. The DEA has had a very long history of denying any applications or have any research on cannabis.
And if marijuana is still listed federally, I don't see how we should be doing this at all then.
Well, every state has been given Eric Holder, the U.S. Not the district attorney, the
Attorney General.
Attorney General, thank you very much. He's come out with guidelines for states that have actually approved cannabis, and he's given the main guidelines is to make sure you don't have diversion, meaning kids don't get it, other places don't get it. It's regulated by a state board, and that it has to be 1,000 feet away from a school, a church, daycare center, so forth and so on. So the federal government has come out on guidelines on how to police this at the states.
But well, then why can't it just be sold with the prescription only?
Because it's a Schedule I narcotic, and you're not allowed to sell Schedule I narcotics. You can sell Schedule II narcotics. There's been some talk by Eric Holder. He was interviewed a week or two ago, and he was talking about working with Congress. He's up for changing the schedule of the drug before he leaves, if Congress is willing. If it becomes a Schedule II, then you'll see more pharmaceutical companies get involved. To me, if they move it to a Schedule II, they're going to have to change the federal view of it and make it
So
legal.
the federal legislature, in effect, it can't be done by executive order or fiat or anything. It has to
That I'm
be-
not sure about. I think it has to be done either through Congress or through the DEA. But some of the things, if I may, the concerns that you have, the dispensaries that I've been to, there was no loitering around. These facilities that you went to primarily were very small. One of the things that was not mentioned about the licensure process in the state of Florida is the financial requirements. The minimum requirement is $5 million in escrow. The license fee is probably going to be anywhere between $100,000 and $200,000 when it's all said and done. The companies who are looking to do this are Fortune 500 like companies. You're not going to have any Fortune 500 companies do it because you cannot get business loans. These are individuals who are passionate like myself. I bring 20 years of healthcare experience to make sure that this is run properly and run efficiently and run in a way that where the city of Melbourne and their constituents can feel comfortable about it being in their, quote, backyard. It will be a professionally run facility. Our location that we're looking at is going to be over 90,000 square feet, where 50,000 square feet will be used for growing. 20,000 square feet will be used for infusion. Infusion means you're taking the plant and you're putting it into an oil and you're putting it into edibles. That's where the patients that I see, I'm also a licensed occupational therapist and nursing home administrator, and I still treat patients all over Brevard County. And the main thing I see with people over 65, 80% of people want this. They want the opportunity to get off the opiates. The problem with the opiates is there's so many side effects. They can't go to the bathroom. They feel horrible. They can't eat. They want the ability to have something different. With this making a statewide mandate to make this legal, it will give businesses like ours the ability to standardize the process. The problems that other gentlemen and other people have with this, and which I agree with, there's no standardization. You don't know what you're getting. With our process, everything will be lab grade, pharmaceutical grade, so everything that you get will be consistent. If you get an antibiotic today, you know it's going to be the same thing you're going to get in 2 years. Well, you need the same consistency with cannabis. You need the same efficacy, and that's what we bring to the table. And that's what all operators will bring to the table. Now, another thing to consider, you can zone all you want, and you can sit there and you can give out potential companies like mine the ability to have a facility, but unless we have a state license, we cannot operate. We cannot grow cannabis. Right now, to give you an example, the state of Illinois just approved medical cannabis. They offered 66 licenses for the entire state. Almost 300 groups applied. So in the whole state, they're only offering 66 licenses. The state of Florida, there's been a lot of rumors on how many licenses they'll offer. If I'm the new governor, or I'm going to be the incumbent governor, I'm not going to offer thousands of licenses. There's been some people that say they're going to be 1,000 licenses, 1,500. My personal opinion is there's going to be less than 100, because the state wants to find this out. It's a new program. They want to see how it operates. They want to see what the pitfalls are. So even if you do have it zoned for 5 or 6 or 7 municipalities that are different businesses who want to come in and do business, you'd be lucky to get one operator. There's not going to be a lot of these. To give you an idea, the CBD that's been passed, that was passed this summer, they're only offering 5 in the whole state. 5, that's it. The minimum escrow is $5 million. The application fee, I believe, is $50,000. This is not going to be a run-of-the-mill, small little operation. The places, that's why we request the industrial areas. You're going to need a lot of space, because we can secure it better. We're in one place, and we can monitor it better, and the city can monitor it better.
There's plenty of room out there by the VA clinic.
Ma'am?
Plenty of room out there by the VA clinic.
You're absolutely right. And I would love to have the money to build a massive building out there and do that, because I live near Vieira. That would be great.
Okay. All right.
Thank you for all the information.
Thank you, Mr.